So, Mais, how did you get the bad news being so young and unprepared?
Yeah, it was shocking, unexpected, especially with my lifestyle. Super healthy, fit, the last candidate that would go for breast cancer, and I don't have a history of it. But I do annual checks. This is part of my annual checks that I get a screening for my breast. I did not have any lump. I did not have any indication that I had breast cancer. But the one indication that I didn't know of is that the nipple was retracting backwards. So something was pulling it in. And I think because nobody ever told me that you need to get to know your breasts, like who would say that? So I didn't know that one was changing, and the doctor picked it up, and that's when she asked for the ultrasound, and that's when the tumor, showed up on the ultrasound. After the biopsy, we knew it was stage 2 cancer.
This is the thing that whenever we are too young, we don't expect breast cancer.
Yeah.
And now it's really well known all over the world that breast cancer age is getting younger and younger. And this is why we have all to be aware that being young or not having a family history or not having risk factors, that doesn't protect you from having breast cancer. This is why we have to be aware about the signs and symptoms of early breast cancer.
Yeah. Right? So I totally agree with Kinda that we see more and more younger breast patients with cancer. And usually the younger you are, the more aggressive the cancer it is, then the treatment will be complicated. The journey will be more bumpy. So it's really, really important to check yourself even from the age of 25. What do you think, Mahira?
Yeah, I was thinking, hearing all this, that usually we don't think that young female will have a breast cancer. And sometimes we just neglect, they seek some medical advice of non-breast doctor, and then they may say, oh, it's just some change of dense breast or lactational breast or something. So I will stress for the self-checkup and go to seek the specialized medical advice like a breast care center or the breast surgeon, so that you will be checked properly. Don't neglect yourself, and then do imaging.
Yeah, I completely agree. A lot of my friends, they tend to go to different specialties, whether to be gynecologist or internal medicine or whatever it is. One checkup is easier to go to one doctor to do everything. And of course, with all respect to all other doctors and their specialty, but like you said, it makes a big difference, because they might miss something that a specialist wouldn't miss. And an annual check is so important, because you don't always, even if you check at home, you might not pick it up. Like I didn't have a lump. Nothing was showing, nothing was visible. So yeah, I think it's really, really important. I mean, it's a team, all of you together. It saves so many lives.
Definitely, yeah. And so my question to Kinda is, what do you think, what's the difference between early breast cancer in a young patient and in a slightly older patient? What's the difference that you can see on images? What's your message to young ladies to do not ignore?
So young ladies, they have dense breast normally. So this is why it's harder to detect. We talk about self-exam always, but the thing that many of the ladies would say, I try, but I cannot feel anything. So normally, if you try, your breast, you will be able to feel the difference. This is very important. So these self-checks are very important. But then if any change, if any abnormal findings, then you will have to check with your breast specialist, because normally these type of cancers can be really aggressive whenever we are young. So the earliest possible is the best outcome. That means whenever breast cancer is small and detected earlier, this will be really easier to treat, and this is very, very important. Normally, we propose ultrasounds every year for these kind of patients. This is very important. A visit to the breast specialist, this is very important, just to be on the safe side.
Yeah, a lot of people have that misconception that, you don't get checked except a mammogram after 40. They don't understand that there is an ultrasound, and there's the importance of an ultrasound before it, and that especially the point that you mentioned, it's for dense breasts, which happens before the age of 40.
Yeah, it's not in the guidelines. This is why. But then again, we will have to be aware. Like, if any symptoms, if any changes, you will have to go and check. And don't be afraid. This is very, very important, because most often ladies are afraid. I'm afraid I have something. I'm afraid I don't want to check it. This is so wrong. You will have to check it. So you put your mind at ease. This is it.
Have to check it.
Yeah, and I have to absolutely. No,
The main important thing is not just diagnosing cancer, but diagnosing it early is very, very important.
True.
Because it will save you from very aggressive treatment, and very minimal surgery might be required. So we have to go and check, and early detection is very important.
I totally agree. So the scary facts that the breast cancer now is the most common cancer in the world. It used to be different kinds of cancer, it's like a bowel cancer, lung cancer. 1 in 8 ladies now, they'll get breast cancer. And it's utterly important to start checking your breasts, let's say from even, from the age of 16, 17. Self-examination is what I always tell the patient, it's your safety net. So self-examination, know your breast, as you mentioned, any symptoms. And we have always, we call the breast lemon. So if you know what symptoms you would get, this is utterly important. We check the patient, and our radiologists check the patient once every 6 months, once a year. Again, this is still a long time. But if you do your self-examination, you feel any symptoms, you get it checked, that's your safety net.
Is it important or actually what I want to know is for people to understand how simple it is when you do a lumpectomy of just removing the tumor? Because I think people are so scared of that part of the surgery, like, no, I don't want to lose my breast. And it's not always the case, If you detect it early, how easy is this surgery?
Well, it is as easy as I always tell the patient that it's easier than removing your tonsils. So screen detected cancer, they are small, they are curable, and when we operate on a screen detected cancer, give them the fact cure rate is over 98%. While when it's reached the level of symptomatic, when the patient starts feeling a lump, it might be a bit more advanced. The treatment will be complicated, surgery will be complicated. The treatment before and after surgery will be different. So that's why screen detected cancer is curable in a very, very high percentage, and the journey will be less bumpy.
That's good news.
I will ask Dr. Wissam, being breast surgeon, about what are the signs and symptoms which female should look for. We are talking about self-examination, so what they should see for actually?
Well, I split it into, as I said, the breast lemons. Let's start with the nipple. So any nipple crustiness, any change in the shape of the nipple discharge, or nipple start retracting. Now, if we talk about the skin, we call it pseudo orange. That's when the skin become very thick and is dumplings, like the orange skin. Or if they notice any redness on the skin that's unexplained. That's why monthly checkup at day 7 of the period. This is essential. So when you know your breast, any changes you can note early. Deep lesion, dilated veins, unexpected. Changing the volume of your breast, changing the shape of your breast, all these like an alarming sign, could be an early sign of a breast cancer, which could save millions of lives.
Any discharge as well.
Absolutely,
The
yeah, the
This is
nipple
very
discharge.
important
Yeah.
as well.
So ladies will take the nipple discharge very lightly, but there are discharge that we're not really worried about, but still need to be reported, like transparent, if it's milk, that kind of thing. But there's a blood-stained nipple discharge, or a discharge that stays there for a long time without any explanation. That's important to report.
Yeah, I think also to keep in mind that they shouldn't be obsessed about it, where they become really scared, where they start looking for symptoms.
Actually.
I mean, it's normal that on a monthly period for the ladies that they might be a slight swelling in the breast. So it doesn't mean that you have breast cancer. That's because of your period. So not for women to understand, not to take things to extreme, as in, you don't do that with your vitamins. Why do it with your breasts? Treat it the same way. Be relaxed about it. Don't look for a tumor, but just be safe and protected with your breasts. And it's. I'm thankful because I actually did that. If I hadn't done my annual check, I wouldn't have been detected early, and I probably would have been on a higher stage. Probably the treatment would have been harder. I still had it a bit tough, but it's still much easier. I mean, if I had known a year before, it would have been as easy, like as you said, Dr. Wissam, it would have been just a slight lumpectomy, like removing a mole.
Absolutely.
This is it. So the magic word is the early detection, actually.
Yeah.
Early
And
detection
not to
can
worry.
make all the difference. And of course, not to worry. This is life. Like,
Yeah.
we live our life and then we're aware. This is it.